Good day, everyone. I am Lubalethu Dube, and welcome to another episode of In Focus. This is the 10th anniversary of Foresight, so very interesting conversations are happening. The theme this year is Let's Co-Create the Future. And one of the talks that we had was given to us by Shannon. Shannon, would you like to introduce yourself?
Hi, I'm Shannon. I'm a cat mom and also an actual consultant. I'm really passionate about healthcare and about more equitable healthcare outcomes, and I'm really happy to be here today with Luba.
It's amazing. So, Shannon, you spoke about spotlighting collaboration between public and private healthcare. How does that actually work? And you actually spoke about a company called Vula, which was a huge central part of this conversation. Do you mind telling us what Vula is?
Okay, so Vula is an app that helps connect primary healthcare workers to specialists. So basically, instead of using a fax or a landline, they can use Vula, which is an app, to send questions through the app to get advice and referrals
Mm.
from the specialists, and also just arrange getting advice in terms of what kind of treatment they need to do and those kind of things.
That's actually really interesting. So, what would you say would be the advantage of using Vula as opposed to maybe another form of connection?
So the one thing is that obviously the HPCSA like regulations in terms of POPIA and like sharing patient information. So something like WhatsApp is probably not best suited for
Okay.
sharing that kind of documentation. But also instead of a phone and like waiting for someone to be online to actually, answer a call from a specialist, they can actually just fill in things and give you feedback during the day. And the response time is on average 15 minutes.
Okay.
And this also means that the primary care doctors can actually get feedback from the specialist and find out if they actually need to send the patient to a specialist or if this is something that can be dealt with on a primary level. So this means that the patients can get diagnosed faster and also start access treatment quicker.
Okay. So, in this app that we're looking at, it's basically an app that is being used by providers, specialists, and the patients as well.
So the patients don't actually use the app, so it's actually only for healthcare professionals.
Okay.
But the patients are the ones being talked about on the app.
Okay. Okay.
But for instance, if one of the cases that stood out to me with Vula was a patient that had coverage for an ultrasound, but didn't have coverage for the surgery that they needed. And so they needed to go into the public sector, but they started in the private sector.
Okay.
So they had the ultrasound done in the private sector, and then the public sector proceeded for the surgery. But through Vula, they could send the X-ray to the public sector, the ultrasound, sorry, to the public sector, and the patient could also carry a copy of that ultrasound. So then when they got to the public sector, they could actually have surgery done much faster.
So that is a huge advantage that comes up then with using Vula. What other, I guess, advantages are there when it comes to using Vula? I feel like you also actually had some case studies that would even illustrate what those advantages would look like.
Yeah. So one thing that was really cool for me to see was this pilot project in eSequini.
Mm-hmm.
So what they found in this area is that a lot of the patients in that area start with a private GP, even if they don't have medical scheme coverage.
Mm-hmm.
But TB treatment and diagnosis is quite expensive. So what this means is that a lot of patients don't end up getting treatment for TB, and this actually ends up shifting into the public sector.
Okay.
So through the pilot, the private GPs were encouraged to test the patients that presented with TB-like symptoms with TB.
Mm-hmm.
And then these tests were then sent to public labs for testing.
Okay.
And then Vula just tied that all together so they could share the information from the private GP. And if they needed to go into a public TB clinic, this information could be received seamlessly.
Okay.
So it's just more coordination of care and more gaps in care were removed. And the patient just experiences care as like a single journey as opposed to being in two separate systems.
That's actually very, very good. It was a much more efficient system, and I guess it would have happened quicker than if Vula hadn't been involved in that situation. So, in your conversations, you have spoken about this need for the public sector and the private sector to be collaborating. And it seems like there is this missing middle of people that seem to be moving from private sector to public sector and people going from private GP to public GP. How prominent is this issue and how many people are part of this middle?
So what we actually see is I can't remember the actual stats offhand, but I think about 26% of people said in the general household survey that they would first use a private GP or go to a private hospital, doctor, or clinic when someone becomes ill or has an accident.
Okay.
But we see about 15.6% of people only have medical scheme coverage. So there's an actual gap in terms of the people that actually do have coverage. So those are the people that would be regarded then as a missing middle who are actually accessing private primary care first before going to the public sector for care. When looking at the LIM study, which was done a couple of years ago, found that people in that income band actually placed more priority on out-of-hospital cover than hospital cover. The value that they placed on out-of-hospital cover was actually 50% higher than on in-hospital cover.
Interesting. So essentially, these people don't mind going to the public hospital. It's just that primary care that they do want to have in like that private care facility. And so now we kind of need to make sure that there's this seamless transition for when they go to public hospitals then.
Exactly. And what we're actually also seeing is this figure take up we see in the primary healthcare products that had exemption from the CMS in the process of the LCBOs not being decided on in light of NHI. But a lot of these patients just say they go to private care because there's faster waiting times, they're more convenient locations, and also like they perceive the quality of care to be quicker.
Okay.
If you think about it from a practical reason, for instance, like if my helper comes to me and if her daughter is sick and she needs to go to the clinic, it means it's a whole day that she doesn't get to go to work. Whereas if she pays to start care privately, it means that she can just go during her appointment time, get care for her daughter, and she can still work that day.
Okay. That's actually a good point. So people would be willing to pay for that private service and then move to a public hospital where need be. And then Vula then comes in as a seamless way to connect these two sectors and just have this collaboration happening. So that's actually quite interesting. Do you have maybe some examples that you'd like to share of how Vula has been used in giving patients this good pathway of care or a good system of care?
Of course. So the one example that we did speak about was a patient who came into a private ER with organophosphate poisoning, and usually this needs intensive care, but the patient didn't have medical aid coverage. So what happened is this was about 2:41 in the morning, and the private sector doctors then contacted the public sector doctors at Livingston Hospital, which I think is in the Eastern Cape, and they contacted to find out if there are beds available. And at that point in time, they weren't. But what they did was the public sector doctors actually told the private sector doctors, these are the tests that they need to get done. This is what they should do to the patient while they're waiting. And about 2:41 in the afternoon, a bed became available and the patient could be transferred successfully from the private sector to the public sector. And this involved about 4 doctors working across the different sectors to ensure that this patient actually got access to care.
That's
And then
incredible.
in another instance, a patient came to a private GP and they had an abscess that needed surgical drainage. But as mentioned, the patient didn't have medical aid coverage, so they couldn't go to a private specialist or go to a private hospital. But the private GP wasn't really sure about like what was the best procedure or like how to best go ahead with this. And so they contacted a public sector surgeon. Unfortunately, the public sector didn't have any beds available. And so in this case, the public sector surgeon actually guided the private GP on how to perform the procedure successfully in their GP's procedure room. And the patient recovered quite well with follow-up care. And it's just an example of how, the doctors are working across the sectors, even if there is limited resources.
That's incredible. So it's a use of these limited resources, doctors coming together across these different sectors and just doing the best they can to make sure these patients are getting the best outcomes. So that's actually an incredible story. So just to tie it all together, I love that you spoke about the fact that healthcare is a spectrum. Do you want to just explain what you meant by that?
Yeah, sure. I think many of us think about the private and public sectors as being quite siloed and that they don't interact. But what we actually saw in the data is that there are people that just use the public sector, and then there are people that have medical scheme coverage that only use the private sector. But in the middle, there are a bunch of people who use both sectors. They start with a private GP and then they move into the public sector when they need specialists or hospital care. And that really just shows like what we're actually seeing, that there is collaboration between the two sectors and why coordination of care is so important.
Thank you so much. Would you have any last things to share?
So Vula helps ensure the patients get the right care at the right time in the right place.
Thank you so much.